Welcome to Word of Mouth, the truth about dentistry, dental educational series for public. I'm Dr. Najafi Periodontist, practicing in San Antonio, Texas. I'm here to bring the dental world to your home, answering your unanswered dental questions based on reliable sources. No advertisements, no sponsors. With special guests who are experts in their respective fields, making dentistry relatable to you, touching upon various dental topics and answering your questions. This is a link between you and dental professionals. This is word of mouth. Our first episode is on COVID-19 and dentistry. Unfortunately, during these challenging days, we are all experiencing uncertain time, something unknown. Aside from the uncertainty, anxiety, and even financial concerns associated with this pandemic, we are constantly dealing with misinformation and rumors from unreliable sources, which may even lead to disastrous outcomes. Trying some home remedies or unknown rituals, which can be dangerous, as seen or heard on the news. Today, we would talk about oral hygiene measures and dental matters related to this new virus. We'll also have our honorary guest, Dr. Purnima Kumar, periodontist and oral ecologist, professor at Ohio State University, shedding lights on some of the unknown aspects of this virus. SARS-CoV-2 is the newest member of coronavirus family. SARS and MERS were the last two diseases originating from animals and then infecting humans. It is thought that this virus has jumped the species barrier, originating from animals, probably bats, then through an intermediate host, probably pangolins, and then infecting humans. As you may have already heard, the symptoms range from mild to severe: fever, dry cough, shortness of breath, and fatigue. As UN Secretary General Antonio Guterres said, misinformation about COVID-19 is the newest enemy. So amid all the rumors, let's review what we know so far. Surviving without living. That's how all the viruses are. SARS-CoV-2 typically spreads through respiratory droplets and possibly by contact. The family of coronaviruses are enveloped viruses. In other words, this virus has a layer of fat encasing them. That means they can be easily killed and washed away using appropriate products. Soaps with mechanical friction can break the fat layer apart and remove it easily. For a detailed list of many surface disinfectants against coronavirus, please refer to the EPA list. So that's easy. Washing your hands and not touching your face is essential to break the chain of infection. However, there is a different side to the story. Based on scientific studies, on average, we touch our face 15 to 23 times per hour. That's a potential vector for self-inoculation and transmission of respiratory infections. In a phone survey, around 78% say they wash their hands before handling or eating food. Or only 34% say they wash their hands after sneezing or coughing. Yes, this is the reality when it comes to the 20-second correct way of washing hands with soap and water. We do not wash our hands correctly around 97% of the time. That's terrible, isn't it? So the best way to prevent the spread of this disease is to avoid exposure to the virus. But with coughing and sneezing, the virus may travel up to 6 feet. COVID-19, although similar to SARS or influenza, it has significant differences in terms of infectious period, transmission, and the extent of the community spread. According to WHO, the most effective ways against COVID-19 are to frequently clean your hands, covering your cough or sneeze with a tissue or the bend of an elbow, and social distancing. Avoiding crowds and staying home these days, as implemented by authorities worldwide, are effective ways against spread of this virus. Avoid touching your face, frequently sanitize the touch surfaces, and of course, don't forget your keyboards, obviously your cell phone. According to American Dental Association, all non-emergency dental procedures should be postponed at this time. For latest updates, please refer to your country and state policies as well as your state dental associations. All in all, if you have a scheduled dental appointment, you may contact the office. They will guide you for the best course of action. Concentrating only on dental emergencies during this time would help with social distancing and slowing down the community spread of the virus. As you may have already heard, dental offices and our procedures are one of the risky ways of transmission due to the characteristics of dental settings. Droplets and subsequently aerosols, which form during some dental procedures, can be means of transmission for SARS-CoV-2. No doubt that avoiding non-essential elective dental procedures during this time would help in reducing the peak incidence, flattening the curve, and slowing down the spread. But of course, in case of dental emergencies, please contact your dentist. He or she would be able to guide you for the next step based on ADA, CDC, and their local association policies. Dental emergencies such as uncontrolled bleeding or infection leading to swelling, which may potentially compromise the airway, or other conditions. If you're not sure whether your oral care is emergency or not, please contact your dentist office. Dental offices have a particular protocol in place by ADA to prevent transmission in their offices. Actually, these days, dentists and other dental professionals are helping their local hospitals and medical centers by donating their personal protective equipment, including masks, face shields, goggles, gloves, and gowns. The main thing these days is to stay calm and focusing more on your well-being and oral hygiene. Spending more time brushing and flossing regularly and improving your home care in order to prevent cavities, gum disease, or any other oral issues. Avoiding smoking and, of course, prevention as usual is always the key. So in the meantime, don't forget to brush and floss regularly. Take care of your body physically and mentally, including your mouth, while you're in self-quarantine. We're gonna have separate episodes on oral hygiene and answering your questions on that later on. According to ADA, rinsing with 1.5% hydrogen peroxide may help before dental procedures. So far, it seems peroxide or any commercially available mouth rinses containing 1.5% hydrogen peroxide may be effective owing to the oxidation process. As we know, coronavirus is vulnerable to oxidation. Based on the recently published paper in Journal of Dental Research by Dr. Meng and colleagues from School and Hospital of Stomatology, Wuhan University in China, where it all started, they have also limited their dental procedures to emergencies only, with patient screening, strict implementation of infection control, and minimizing aerosol generating procedures for now. So take a deep breath, reduce your stress, and take good care of your body, mentally and physically. Now I'm going to turn it over to our special guest, periodontist and oral ecologist, PhD in oral biology, and professor at Division of Periodontology, OSU. So without further ado, Dr. Purnima Kumar.